I think this has been a good ASCO for new data in breast cancer in a number of areas. Obviously the headline study is TAILORx. Everybody's talking about TAILORx using Oncotype DX testing and looking at the impact of chemotherapy in patients with an intermediate score, and the data suggesting that at least overall patients didn't benefit from chemotherapy over hormone treatment. I think we need to digest that study a little bit and decide whether, who are we going to recommend Oncotype testing for. I think many of the patients that were tested in the trial in the UK, we wouldn't actually even send for testing. We wouldn't have been suggesting chemotherapy for them. So we need to think about that a bit. There's some uncertainty about the younger patients as well. Maybe some of them do benefit from the chemotherapy. In the other area, the thing that I found really quite exciting was some work around targeted therapies for triple-negative breast cancer. So there were a couple of presentations looking at drugs that affect the AKT PI3 kinase pathway, which is not something that's been particularly looked at in triple-negative patients before. But there was a very nice study from Peter Schmidt and colleagues looking at an AstraZeneca compound which inhibits AKT, showing that this added to paclitaxel in the treatment of advanced triple-negative breast cancer. So I think that drug may move forward, and there are other agents in that affect that pathway that seem to be having at least preliminary evidence of efficacy. Other areas that I thought were of interest were a little bit more refinement about endocrine treatments in breast cancer, so a bit more detail about CDK4/6 inhibition, being able to use it in pre-menopausal women using Abemaciclib. That was not a surprising result, but an important result with that agent. And a trial with Ribociclib and Fulvestrant showing that combination could be used up front. And that's not something we'd normally do in clinical practice, but the data looked good, and certainly Dennis Slayman, who was presenting those data, felt quite strongly that was the best partnership for a CDK4/6 was Fulvestrant.